the next speaker, I mean, that's literally is his cue. So you basically just channel the conversation directly where I wanted Dr. Oshuniyi to also share some more insight on. So Dr. Oshuniyi, again, still referencing challenges, opportunities, and regulation, but now you can also speak a bit more from your core expertise on healthcare management, the insurance angle to it, and also further thoughts. Dr. Oshuniyi, over to you, sir.
Thank you very much, Saheed. It's a pleasure being here. It's funny that more people have drawn my attention to this event than any of 20 events before this. Everyone seems to, want me to be part of this, and they see my face on the flyer, and they draw my attention to it. So awesome. It's been very well publicized.
Appreciate it. Thanks to the team.
I visited your website, and I get the impression that your organization is geared towards assisting people who want to invest in Nigeria to come back home to do so and to facilitate that process.
That's also correct. Now, yes.
Because my interest and expertise is in health finance, I'm going to start from a broad base and then narrow down to health. Every single industry in Nigeria is underserved. Banking, agriculture, health, education, everything. And that reflects in just how much finance is available to do anything. Now, let me give you some numbers. Mm-hmm. The per capita income of America, United States of America,
right,
is some $6,000 per annum. For Nigeria, it's more like 1,500 to 2,000. It's a moving target because the exchange rate keeps on fluctuating.
Right.
So disposable income is microscopic here compared to the United States of America. It's very interesting to note that the budget of New York City is about something a little over $100 million.
Mm-hmm.
Whereas the budget of Nigeria for 2024 in dollar terms is in the region of $15 to $20 billion. So there's more funding in New York City that has 8 million people, 4 times more funding than in Nigeria that has more than 200 million people. And you will observe that, the Dr. Gumbi and Dr. Lubogi emphasize this issue of finance.
Right.
I'm trying to draw a picture here of inadequacy. Now, our GDP moving target also between $300 and $450 billion per annum. Of that, about 3% goes to health. And that translates to a sum of about $9 billion to $15 billion. Okay. The health industry in America is a $4.4 trillion industry.
Right.
It's always a surprise to me when people expect American standards of healthcare in Nigeria. It's just not going to happen. So we're coming closer home. Our GDP is not very good. But worse still is the fact that Nigeria is not a nation of taxpayers. Our tax to GDP ratio has been put at about 8%. But in reality, if you calculate it, it's actually about 5%. What does that mean? For every $100 generated in Nigeria, only $5 is paid as tax. So even government is underfunded. Whereas in South Africa, the figure is 26%. In France, it's about 45%. European countries generally will do 35 to 45%. And what that means is that the federal government budget for health for 2024 is in the region of $1 billion. Right? Of that $1 billion, $800 million is recurrent expenditure. And only $200 million is capital expenditure. That means the federal government is budgeting $1 per Nigerian for capital expenditure. It's a joke. We're not going to get anywhere, with those kind of monies. If you contrast Dr. Elebute Adusi's session with Dr. Lugogi and Dr. Ogubi, you will find that it's very interesting. The two later speakers were more public sector aligned, and they highlighted the problems. Dr. Lugogi spoke of the time when you could actually pick up materials on the tray and get a cannula, you want to set up a drip, it's all there. But we can no longer do that.
Right.
Dr. Elebute Adusi is a heavily funded private sector person, and it shows what can happen if enough funds go into health. You know, I have been to Massive Growth, and you could be anywhere in the developed world. You could be in London or Sydney or New York. It's a superb environment, spotlessly clean, not a cobweb in sight. Fragrances, assailing your nostrils as you enter into the hall. State of the art. But I have also been to some health centers which will take your breath away at the sheer dilapidation of the health system. So what do we need to do? In our own industry, in health finance, the HMO industry,
right.
We know that the premiums are too low to make the kind of impact we want to make. Average premiums in Nigeria are $30 per person. Average premiums in America are $10,000 per person. And people expect the same level of care, a Mr. Ruth level of care. So what do we need to do? The country needs to grow wealthier. So I encourage everyone listening from NAPAC CDI, please come back home. Come and invest, create wealth, start farms. You're driving from New York to Washington, it's corn all the way. Come back and do that here. Let the country be really, truly wealthy. And then the country also needs to pay more tax. People need to pay tax. The excuse is, if I pay tax, they will steal the money. But it's a bit of a chicken and egg situation. If you don't pay tax, everything just goes downhill. So not enough money is coming into funding, and we're thinking of all sorts of solutions, including, and you may not like this, the audience may not like it, a tax on remittances from the diaspora. So if you send $1,000 back home, we may be taking 10% of it or 5% of it just to shore up our health system. I think I should close on that alarming note, and discussion continue. Thank you very much.
Well, very soon my phone and inbox of my colleagues will be blowing out that, okay, this is what you called us to come listen. I guess we're working for the government now. But full disclosure, NAPAC CDI does not work for the government of Nigeria, nor the government of the United States. We're a private sector funded corporation for profit. But we appreciate the insight you just shared, Dr. Oshuniyi. Again, I didn't see that coming. The emphasis on the diaspora and the roles that we play in not just the healthcare, but the economy as a whole, because once there is substantial and enough fund in the system, I do agree with you that, we could be able to do a lot more. But I would take a quick pause here to actually thank all our panelists for the beautiful input and insight that you've all shared so